So let's look at dermatome areas across the body, using both the Keegan and Garrett and Forster maps for comparison. I like to work my way through craniocaudally, so we'll start with the dermatomes of the face. It's important to remember that the dermatomes of the face are not actually innervated by spinal nerves. There are 3 dermatomes in the region of the face, all of which are innervated by branches of the trigeminal nerve, which we know is a cranial nerve. We know that there are 3 divisions of the trigeminal nerve, which means, yep, you guessed it, each division of this nerve innervates one of the dermatomes of the face. The forehead and the nose are innervated by cutaneous branches of the ophthalmic nerve. On the maxillae, or cheekbones, we find the dermatome referred to as V2 innervated by the maxillary nerve. Finally, the mandible and the area in front of the ear is innervated by the mandibular nerve and forms the V3 dermatome. In reality, however, studies have shown there's a significant overlap in these particular dermatomes, which should be taken into account in clinical practice. Right, so now that we've covered all there is to know about the dermatomes of the face, let's move on to looking at the rest of the dermatomes. You know, the ones that are innervated by the spinal nerves. Once again, we're looking at comparative images of the Keegan and Garrett dermatome map, seen here, and the Forster dermatome on the opposite side, right here. We'll also be using images of the dermatome maps depicting both the anterior and posterior aspects of the body. That is, of course, because the dermatomes stretch across the whole body, but they may not necessarily look the same on the anterior aspect as they do on the posterior aspect. Finally, let's have a look at the C2 and C3 dermatomes. As you can see from both maps, it is generally agreed that this dermatome covers the supero-posterior aspect of the head. How far it extends down the back of the head is another question. As you can see here, the Keegan and Garrett map shows the area around the ear and lateral cheek, in addition to the region immediately below the jawline and chin as belonging to the C2 dermatome. However, you'll notice that in the Forster map, this area is attributed to the C3 dermatome instead, which has now been confirmed by a clinical study. You'll also notice that the C3 dermatome of the Forster map extends onto the supraclavicular region on the anterior aspect, which is not demonstrated on the Keegan and Garrett map. The C4 dermatome also carries a significant variation between the 2 maps, and this one is worth noting, as it is a common dermatome tested in neurological examinations. Looking first at the Keegan and Garrett map, you'll notice it consists of just a thin band on the posterior perspective and is limited mainly to the base of the neck and regions above the clavicles on the anterior view. Notably, it does not extend laterally towards the shoulders. I want you to also note that the dermatome on this map immediately below C4 is the C5 dermatome, which you might expect. But more on this later. Looking at the Forster map, however, we can see from the posterior perspective that the C4 dermatome extends much further laterally and expands over the posterior aspect of the shoulder, continuing onto the anterior aspect of the shoulder and medially over the pectoral regions. Note here, however, that the dermatome immediately below the C4 here is the T2 dermatome. So there are significant differences here, but who's right? Well, we found sources which support both arguments, which more than likely comes down to individual variation. For example, the superior pectoral area, as well as the deltoid areas, are innervated by the supraclavicular nerves, which happens to show variably in at least 50% of the population. For example, this group of nerves are usually composed of nerve fibers from only the C3 and C4 spinal nerves, which would support the Forster map. It may also variably contain fibers from the C5 spinal nerve, which in such cases would support the Keegan and Garrett map. Before we learn about the dermatomes of the upper limb, I want to quickly show you the dermatomes of the trunk because they're super easy. Although our 2 maps largely agree with one another, there are 1 or 2 major differences. The most obvious of these is the presence or absence of the T1 dermatome on the anterior chest wall. Once again, anatomical variation may, at least to some extent, account for the difference here. In general, all intercostal nerves, which are branches of the thoracic spinal nerves, have anterior and lateral cutaneous branches which innervate the thoracic wall. The first intercostal nerve, which is a branch of the T1 spinal nerve, usually lacks these cutaneous branches, which would innervate the overlying skin. This is why the T1 dermatome is omitted on the chest wall on the Forster map. As we move down through the remainder of the thoracic dermatomes, you'll be happy to know this section of our dermatome map is pretty straightforward. From around T2, or the level of the axilla, the dermatomes are basically just longitudinal strips stacked on top of each other, all the way down to the T12 dermatome at the pelvic girdle anteriorly. If you found this quick anatomy or physiology video helpful, you'll enjoy our video tutorials even more. Click on the button and you'll see what I mean. We have hundreds of videos available to our premium members, not to mention all the fun quizzes, complete articles, and atlas sections to solidify your knowledge. Click on the button in the middle to watch the full-length video and master anatomy and physiology.